This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Dydrosterone 10 tablet is a hormonal therapy designed to manage progesterone deficiency. It helps alleviate menstrual pain and symptoms associated with hormonal imbalances in women. Indications and uses. This medication is indicated for the relief of menstrual pain, management of endometriosis symptoms, and addressing premenstrual syndrome. Additionally, it is used to support female reproductive health and alleviate postmenopausal symptoms when combined with estrogens. By restoring progesterone levels, it aids in correcting irregular periods and infertility problems. How it works. It works by supplementing the body with sufficient levels of progesterone, thereby improving uterine lining thickness and alleviating symptoms related to progesterone deficiency. Directions for use. Take this medication as advised by your physician, swallowing the tablet whole with a glass of water. It should not be crushed or chewed. Consistency is key. Try to take it at the same time each day. It can be taken with or without food, but follow your doctor's recommendations regarding the correct dosage and duration based on your individual health needs. Possible side effects. Common side effects may include severe headaches, nausea, breast pain or tenderness, and irregular menstrual periods. If any side effects worsen or if you experience unusual symptoms, seek medical advice promptly. Precautions and warnings. It's crucial to consult a healthcare professional before starting this medication, especially if you have liver problems, a history of depression, or other health concerns. This medication should not be used in individuals with certain tumors or if pregnant or breastfeeding. Regular checkups and monitoring are recommended during treatment. FAQs. 1. What is Dydrosterone 10 tablet used for? It is used for managing progesterone deficiency and alleviating menstrual pain. 2. How should I take it? Swallow it whole with water as prescribed by your physician. 3. What are the side effects? Common side effects include headaches and nausea. 4. Can I stop taking it suddenly? No. Consult your doctor before discontinuing use. 5. Is it safe for children? It should only be used in postpubertal females if prescribed. Thank you for watching. If you have any questions or suggestions, please leave a comment below. We appreciate your engagement and hope to provide you with more informative content.